Hello everyone, welcome back to this episode where we discuss hormones, health and everything in between. So Stella Chonka is my name, and you are?
I'm Dr. Agatha Nambuya.
Yes, and last time you talked to us about everything concerning endocrinology and what affects the endocrine glands and hormones and all those things. But today specifically, I was wondering about something that has been around quite a lot lately.
Yes.
And those are the issues with thyroid. The thyroid gland, I know that the thyroid has hormones, I'm not sure. So today we would like you to help us understand and appreciate the thyroid gland, what it is, what affects the thyroid, early signs, and all those things that we feel we have been neglecting as people because we don't even know the signs, we don't even know if it's affected. So please tell us about the thyroid, what would affect it as a part of the hormonal system.
Yeah, the thyroid gland is actually the biggest gland, the biggest endocrine gland in the body, and it is found in front of the neck, and it produces hormones which control the function of most of the systems of the body. And when the hormone levels which are produced by the gland go low, people go sick. When those hormones go high, people go sick. So this gland produces a very important hormone in the body called thyroxine. And this hormone is produced in such quantities that the gland stores a lot of it because the body needs it all the time. This hormone is the one which controls how fast your heartbeat should be, what body temperature you should have, how much you are able to sleep, how you think, how your body handles food, many functions, every system which is working in the body.
Okay.
This hormone is controlling how fast or how slow that system should work.
Okay. All right. So because this hormone is what affects how fast or how the entire system should work, how do we then know that there is a problem? How are we able to determine that there is something wrong with our fibroids?
So the thyroid, I can divide the problems there into two. One is its size. Sometimes this gland is slowly but surely growing over your lifetime and it is disfiguring. Sometimes this gland, when it becomes too big, it is pressing on other structures in the neck. For example, the swallowing tube. You find somebody has that big swelling. By the way, the swelling, we call it a goiter. When the gland becomes big, we say you have a goiter. Otherwise, some people think that the gland itself is called a goiter. It is the swelling which then becomes the name for becomes a goiter.
Okay.
So when this goiter grows, it may be growing backwards and press on the swallowing tube, we call esophagus. And in that case, the person will find it difficult to swallow food. Maybe he swallows but slowly and it goes. Maybe some people it is so bad the food is not going.
Okay.
Sometimes they have to force the food down with water or some drink.
Okay.
The second problem you get when the gland is big, it may press on the trachea, that is the breathing tube, because all those tubes are there in the neck behind this gland. So when it is pressing on the breathing tube, the person finds it difficult to breathe. Somebody can say, when I lie down, I can't breathe. When like the villagers, they have to carry loads on the head, they cannot put up their hands and breathe. The time he wants to put up their hands, they find it difficult to breathe.
Okay.
And others, as I've said, when they lie on a certain direction of body, maybe they find it more difficult to breathe. So basically it can press on the breathing tube and cause difficulties in breathing. The third thing is that it can press on the nerves which control your voice. Like I'm talking, if the gland is pressing on the voice, the voice becomes hoarse. So if your voice was usually a certain level and you find it is now becoming hoarse, then you know that this gland has grown and is pressing on those nerves. We call them laryngeal nerves.
Laryngeal nerves.
Laryngeal nerves.
Okay.
The name doesn't matter, but the main thing is to know that when the voice becomes hoarse, some of them it is so severe that even they lose their voice. So those are signs that the gland is actually trying to strangulate the person.
Okay.
And if people refuse early or timely attention, some people really get suffocated. Yeah, that's the thing. So those are the problems you can get for the gland growing big. But some patients, the gland is growing outward.
Okay.
So that there is no pressure on these structures, but they become disfigured.
Yes.
Especially, we know that this problem of thyroid is much more common in women. You don't want to look good. I mean, you don't look good when you have a large swelling in your neck.
In the neck.
So we say there is a cosmetic problem.
Okay.
Yes. So the second major effect of the hormone change of the thyroid gland is hormone changes. This gland may be either producing too much of that hormone, thyroxine, or it may be dying. It can be large but not functioning.
Okay.
When it's not functioning, then the hormone levels are very low. So both ways, people get sick. When the production of the hormone thyroxine from the gland is high, the patients feel hot, they feel shaky, they have palpitations or internal
Yes.
Sometimes they fail to concentrate. You know, they are up and about.
Yeah,
They
everywhere.
are fidgety,
They're not sleeping enough.
they don't sleep enough. They actually fail to sleep sometimes, and the body is shaking. And many times we check by seeing the hands go like that. But sometimes the person himself will feel that there is kujugumira inside. You feel that shaky from the inside. Yes, but the most common is that the heartbeat is very high. It is really, really, really racing, and we can even see the blood vessels in the neck dancing away. And then when it is so bad, these patients become weak and they are tired. They have done very little, but they feel tired. They are exhausted. Because the excess hormone is actually speeding up every system in the body. Yes, particularly the heartbeat and all this. The brain, some people become, anxious, and
they have anxiety all the time.
They have anxiety, they are agitated. Some of them can even manifest psychiatric signs. That means the brain is being driven by this excess hormone coming out. And many systems, including reproduction, especially men, they become weak. And the women, the hormone changes may interfere with their menstrual cycles. They can interfere with pregnancy. You fail to get pregnant, and on and on and on. Every system has a sign there.
Yes.
And for us who know them, we keep asking you to know which signs you are having. Some may have one sign, some may have two, some people may have very many. Depending on how long the problem has gone on without you knowing. And because it affects many systems, patients normally end up in many clinics. They go to the heart doctor, they go to the reproduction apart, they go anywhere as long as there is a symptom in that system.
Okay.
And as I've said, when the hormone is that high, it can affect everything. Even going to toilet, people go to toilet many times, especially they wake up at night to go to toilet because the intestine is being overdriven by these hormones.
Okay.
Yes. So that is some of the signs you can, when the hormone production from the thyroid gland is high.
Okay.
But sometimes the thyroid gland is dying, it's not producing.
Okay.
So when it is not producing enough hormone, you get the opposite of everything I've said. Instead of being agitated and over talkative and jumping around, you go back in your shell.
You're quiet.
You're quiet. You don't want to associate. You feel basically you can say the person becomes like depressed. So they don't want to associate. They can even become moody. You say something they don't understand, like if they are a couple in the house, they start misunderstanding each other, they quarrelsome, and the body of the person who is suffering becomes cold. You touch the person, the skin is cold, and the people gain weight. The weight goes up. Again, with the reproduction, anything can happen. Either the menstrual periods may stop, or you get little coming, but ironically some, they may open up so that you are overbleeding. Depends on how it affects an individual. Yes, you can see this hormone is extremely important.
Okay.
When it's too much, you are sick. When it is too low, you are sick. Unfortunately, you cannot know that this is the problem unless you check. The most important thing to do when you suspect a thyroid problem, you cannot guess that this is thyroid because all the signs I have mentioned, they can be produced by any other disease. So the main thing is for the patient to go to the doctor. You come to us, we take your blood and we measure the level of your hormone.
Okay.
And when we find it high, we know how to treat you. When we find it low, we replace the hormone which is missing. And when it is low, usually patients need this hormone replacement. We give you thyroxine, and you take it for life. Because the body needs thyroxine, you like it or not, it needs thyroxine. So if the thyroid gland is not producing enough for you, we give you this thyroxine replacement for life. The doctor will diagnose you that your gland is not working and will give you the tablet called thyroxine. And everybody who gets thyroxine, the amount we give depends on the person's deficiency. Some people are very, very deficient, we give a large dose. Some people are just less
fairly deficient,
and then we give. But unfortunately, even if you are fairly deficient, the body is not working well. So we encourage people to come and have the thyroid checked. Even if you are not sick, each time you have a chance of checking up, you check other things, but check for thyroid hormone as well.
Okay, so with that one now, I still want to understand. I would like to understand what causes the thyroid to act the way it does, either to the lower end of hypothyroidism or the hyper side. What would be the most common causes to this?
Yes, I have said the thyroid diseases, all of them are more common in women than in men. So it is, we said there is this predilection to affect women more than men. But it doesn't mean that men are not affected. They are also affected, but to a lesser extent. So that sex of the person becomes an issue. That you are a woman, if anything happens to you, the thyroid will be sick. So women become a target. You make sure that you, as you are functioning and you are growing up, make sure the hormone is okay.
Yes.
Yes. Otherwise, you may go that think that they have bewitched you. That's why you are not able to get pregnant. It may be just that.
Just that, and if they work on it, you can be okay.
Yes, you become okay. That our psychiatric patients, many of them, we treat them. I treat them, in collaboration with the psychiatrist.
Yes.
Because what has caused a psychiatric problem is the hormone imbalance. So I treat the hormone, but I also make the psychiatrist control the mental issues.
All right.
Otherwise, we want the patient to be quickly managed and they live a normal life. So that's one. Being a woman is one of the predisposing factors. Number 2, iodine. Which we get from soil and water. All the food we eat, the dodos, the meat, name it, whatever you eat, we are eating iodine from the soil. We call it iodine chain. So iodine should be in the soil. When the plants grow, they have iodine in them. When the cows eat the grass, they are eating grass with iodine. When the fish is in the water, it is eating iodine. So when you eat fish, you are eating iodine. So there is iodine in the food chain.
Okay.
Unfortunately for us who live in volcanic areas, volcanoes, when they erupt, the inner part of the crust is pouring out, and when it pours out, it solidifies and becomes soil. And we plant our food on this soil. And many times that food is growing very well, because that soil contains many other nutrients. But unfortunately, it does not contain enough iodine. So that people who are living on the mountains, like just in Elgon, in our country, on Elgon and in the Renzores, but the whole world where people live in volcanic areas, the soil does not contain enough iodine, so there is not enough iodine in the food chain. And yet this gland requires enough iodine in the body in order to manufacture the thyroid hormone. So the whole thyroid hormone cannot be manufactured enough if the body does not contain enough iodine. That's why when you look at people affected, most of the patients with the goiter, they are in these mountainous areas. And most of them are women. So in the village, everybody may think, it is normal. For us here, all of us have goiter, it is normal. It doesn't pain, it is not pressing on their structures.
So they are just like...
They are just like that. Sometimes you find the gland is so big, but they are not bothered. Because we Africans, unfortunately, when something is not painful,
it's not a problem.
It's not a problem. You don't need to go to the doctor. After all, it doesn't pay. So they stay with their glands, but they are sick. Because some of those glands, when the amount of iodine they require is too little, the amount of hormone they are able to produce is
also little.
So such patients, we replace the iodine. So that's why in most countries, the authority makes sure that the people are given more iodine to take in the diet. So most of the time, like in our country here, the water is iodinated. So it's many other countries. Some countries will put iodine in bread. Because some countries, their staple food is bread. So they will put some iodine in bread. But unfortunately, it can become dangerous for people to start dosing themselves with iodine. Because this gland is hungry of iodine. It may overtake in iodine sometimes and turn the patient to get complications of excess iodine. So it is always, if you think the person has iodine deficiency, you should approach the people who understand how to manage thyroid and put the supplementation of iodine. The third problem you can have is that there can be autoimmunity.
Yes.
These are inherited diseases whereby the body produces antibodies or substances which start reacting against the body, the tissues of the person himself.
Yes.
So there is some degree of self-destruction. And when it comes to the thyroid gland, this gland can be destroyed by antibodies produced in the person, and that gland will those antibodies will either switch the thyroid gland to overproduce the hormone,
yes,
or it can make the gland slowly die away, so that the hormone coming out of it is not enough.
Yes.
So these are inherited diseases. They run in families. That's why you see many patients with thyroid problems. They have a relative who has had a similar problem. So if you see somebody in your family, these days people think that family is mother, father, and the children, but actually family is a clan.
A clan.
You share hormones.
Ancestors,
Yes,
grandparents,
it's a very long chain, ancestry. So if you know anybody within your ancestry who has a thyroid problem, maybe you may also have it. It is maybe, because many people escape, but some do not escape.
Somewhere along the way.
So, but it doesn't matter whether you have seen anybody in the family or not. You as an individual, when you have it, you have to get treated. And the people you know who are within your lineage, you do well to inform them that please check your thyroid. We may be having a family history of thyroid issues which can be treated. All thyroid diseases, we treat them. Yes, and people live a normal life.
Okay.
So another cause of thyroid swellings, you may find that the thyroid is growing, especially if it is growing quickly and it is painful, it may be cancer. So not all those goiters are innocent. Some of them are cancer. And you can't know that now mine is cancer unless we check and find out what it is and give appropriate treatment. Most of the time, even thyroid cancers, we treat them and people become okay. Especially when you come early
and it's called earlier.
We remove the cancer quickly and we follow it up with appropriate treatment. People recover and they live a normal life. Okay? Yeah, so those are some of the common causes. The inheritance, the iodine deficiency, cancers, and the female sex. There are other smaller causes, but the ones I've mentioned are the biggest.
Are those primary ones?
Yes.
Right. So, how can one live a normal? First of all, can one even live a normal life with this situation? Maybe they've been told you have thyroiditis and it's hyper or hypo. Can one live that normal life? And if yes, how so?
So you have mentioned another cause of thyroid problem. It is infection. We call it thyroiditis. You can get infected. The infection, just like it, you can get infection in your liver, you can get infection in your food. So you can get infection in the thyroid gland. In this case, it is painful and you have a fever.
Yes.
So it is easy to know that you are sick. So such people may also develop a goiter. Some they may have no goiter, but the gland is sick. So you come with a fever, you have pain in the neck, we quickly check for the hormone. And the hormone level will tell us, yes, there's a problem. Sometimes we follow it up with specific imaging, and it will tell us, yes, the gland is sick. Yes. So those are acute causes. But otherwise, the ones I mentioned are the chronic ones. And these are the ones where people neglect because the gland is not paining.
Yes. Okay. All right. So how can they live a normal life after they've been told?
For example, if you have thyroiditis, it is inflamed, it is painful, you have a fever, you are vomiting, you can't swallow, you come quickly, you check the hormone. and we know how to treat you.
Yeah.
Treat the infection, but we also treat usually the hormone level will be very high when there is infection there, because the gland stores a lot of hormone, and when it is infected, the gland is breaking down, so it is pouring a lot of hormone in the system. So you are sick, you are shaking, you are hot, you are agitated. So we know how to control the hormone action on the body. We give you specific treatment to control that. And many times you become okay, you get cured, and that's it.
Yeah.
Only a few, it may keep coming back. Just like you see flu keeps coming back.
Yes.
So even the inflammation in the thyroid can keep coming back. But each time it comes, you come out with treatment. And when you finish the treatment, when you have had inflammation or infection in your gland, the gland may first, it has been destroyed and shocked. It will completely shut down. So we need to replace the hormone for you. Otherwise you may think, now I'm okay, but why am I now tired? I feel cold. I have to put more blankets. Why? Because the infection destroyed your gland. So nothing else will help you improve unless we replace them.
The hormone itself.
Yes.
Okay.
Yeah. Those who have like the inherited one, we identify the diagnosis and we treat specifically for that type of thyroid problem. So I may not mention the drugs, because it depends on the patient. Most patients, when the gland is overworking, we give the medicine we call it the anti-thyroid drugs which block the release of hormone from the gland. Some we do that, but some, even those tablets, will not control the gland. So we go further. Some of them we treat them with radioactive iodine. The iodine, the radioactive one, will be handled in the body like any other iodine. But the person we give radioactive iodine must have a specific type of thyroid problem. That the gland is overproducing the hormone. So we must really stop that gland quickly. To stop to produce the excess hormone, so that the person comes okay.
And have a balance.
And once we have treated with the radioactive iodine, you know that we have knocked your gland out. It's like you have fire, which you have a bonfire, or the house is on fire. You will not say, that is my table, I can't pour water on it. Of course, you aim at extinguishing the fire quickly. Then you come back and see what else can you do. So when the gland is overproducing, we give radioactive iodine. It doesn't go to other parts of the body. It won't destroy anything in you, but it goes straight to the gland and concentrates there and knocks it out. So what about when the gland is having pressure on the neck? This one is one of the big indications that you need that gland cut out quickly before it strangulates you. So if you are not able to swallow, you are finding difficulty in breathing, you are having hoarseness with that large goiter in your neck, the only treatment is to cut it out. That is surgery. We remove it. Some people come and say, please give me tablets to make it go away. It cannot. It cannot shrink. And then also when we suspect that it is cancerous, we will quickly counsel you and remove that gland and take it for checking to see which type of cancer you have. Because there are many types of cancer which can affect the gland. So we remove it. We suspect it is cancer, we remove it, we go and check. We determine what cancer. And treatment depends on what cancer, what cancer they find. Yes. So that's so that in the end, some patients are treated by operation, some patients are treated by drugs which stop the thyroid from overproducing, some people are treated by iodine to eradicate the whole gland, radioactive iodine. Some people are treated with normal, we call it elementary iodine, to allow the gland to manufacture
the hormone on its own.
And some people will be treated by antibiotics and painkillers. So the treatment depends on what's wrong.
What the problem is. Okay.
That's why I'm emphasizing this. Some patients come to me and say, hey, my colleague came here, you treated with radioactive iodine, she's now okay. She has even had a baby. I also want to be treated with it. You cannot want.
Yes.
We have to find out whether
what the
need
problem
it
is first,
and
then see is it
see
an
whether,
need.
if your problem is similar to your friend,
Then
we also give the ID. But many times you find that the problem is different. So some people get disappointed. Why wasn't I given iodine? You cannot be given a drug which is not going to help
you.
Yeah, that's right. So in the long run, I'm encouraging everybody, you examine your neck. Most people, they will have a goiter. They will not see it. A friend will see it, especially when they are swallowing. You say, hey, there's something on your neck. We accept.
Does it move like?
It moves.
You see how many
when you
used to have that thing, the Adam's apple?
Yeah.
Does it move like that?
It moves like that, but it is below the Adam's apple.
Okay.
It is between the bone here and the Adam's apple.
Okay.
Yeah. So when you see a swelling in your neck, don't ignore it. Bring it and we find out what type of the problem you have. And therefore we give specific treatment.
Okay.
Most of the time, let me say 90% plus, people become okay when we treat them appropriately. Yes.
Okay. Thank you so much, Doctor, for this guidance. I think it has really shed more light on the things that people are suffering but they have no context, because maybe no one ever talked much about it, or this, like you said, people think I have been bewitched, or I ate a hot potato, that's why I have a swelling. But indeed this gives more clarity, and I really hope that we are able to have more of these conversations, just so we can shed more light on what's affecting us as a gender, as men, as women, as a generational group right now, because I'm sure some of these things are more rampant now than they were before.
Yes, and the management of thyroid diseases in this country is very slow coming. So most people don't know who can treat them. We have had patients travel to India, travel to South Africa, because they don't know who can help them with this.
So if someone had that problem, they can come to you?
They can come to me.
Okay. Where can we find you?
I'm found in Goiter Medical Center. It is found in Kasangat Town Council.
Alright.
Off Kira Road.
Off Kira Road.
Yes.
Alright.
And if you pass on Kira Road, you'll be able to see that signpost. Just immediately you go down the slope on Kira Road from Gayaza Road.
Yes.
You will see the signpost reading Goiter Medical Center.
Alright, we shall put the phone numbers here actually, so that if they need to have to book consultation and all those things, they can reach out and then you'll be able to help them.
Yes.
Thank you so much for sitting with us through this episode. I hope you learned a thing or two. Feel free to ask questions in the comment section. We'll be happy to respond as soon as possible. Dr. herself will be providing more context, more answers about these issues. But if you want to seek consultation and get help, please do not sit home and fail to go for treatment. Come through to Dr. Nambuya. She'll be able to guide you. And like she said, there are also many other places where you can go and get the help that you need. Other than that, have a blessed day.